The rapid increase in confirmed cases makes the prevention and control of COVID-19 extremely serious. Although the clinical manifestations of COVID-19 are dominated by respiratory symptoms, some patients have severe cardiovascular damage. A 12-year follow-up survey of 25 patients who recovered from severe acute respiratory syndrome, commonly known as SARS-CoV infection, found that 68% had hyperlipidemia, 44% had cardiovascular system abnormalities, and 60% had glucose metabolism disorders. In these patients, the serum concentration of free fatty acids were significantly increased compared with individuals without a history of SARS-CoV infection. However, the mechanisms by which SARS-CoV infection leads to disorders of lipid and glucose metabolism are still uncertain, given that SARS-CoV-2, commonly known as COVID-19, has a similar structure to SARS-CoV. This novel virus might also cause chronic damage to cardiovascular system, and attention should be given to cardiovascular protection during treatment for COVID-19. Research according to National Health Commission of China (NHC) shows that some of the patients first went to see a doctor because of cardiovascular symptoms. The patients presented with heart palpitations and chest tightness rather than with respiratory symptoms such as fever and cough, but were later diagnosed with COVID-19.
There's a very strong relationship, and there's many relationships between COVID-19 and cardiovascular health in general, okay? A lot of this data we've gotten from Chinese studies because they had the largest number of cases at that time. And COVID can affect the heart both directly and indirectly, okay? Directly, the virus can actually go and infect the muscles of the heart and cause an intense inflammation, which is called myocarditis, okay? So when you get myocarditis, the heart becomes very weak and it's unable to pump blood. So that's one of the ways by which the COVID affect the hearts directly, okay? Apart from that now, COVID can also cause certain rhythm problems in the heart, okay? Certain electrical abnormalities have been noted in patients who have been admitted with severe COVID disease, okay? And when you get rhythm problems in the heart, this impairs how well your heart works, and it can actually predispose you to dying suddenly.
Among the people who died from COVID-19 reported by the NHC, 11.8% of patients with underlying cardiovascular diseases had substantial heart damage with elevated levels of cardiac arrest during hospitalization. Therefore, in patients with COVID-19, the incidence of cardiovascular symptoms is high, owing to the systemic inflammatory response and immune system disorders during disease progression.
COVID causes a very intense inflammatory response, okay? So you get inflammation going around in your whole body. And when that is going on, you need your heart to be working extra hard, right? When it's working extra hard, the demand sometimes may be too much for the heart, okay? And in that way, it also suffers. So there's been a strong associations between patients who have COVID and who die because of either direct or indirect involvement of the heart.
COVID-19 pandemic has brought with it a great deal of ailments, or needless to say, other sicknesses that have been resurrected by the emergence of COVID-19. People having underlying ailments or conditions have been affected the most. We met George Ambayo, who had a previous heart attack, and after going through a 19-hour open heart surgery, he had this to say.
Some of the challenges, number one, having gone through such a major surgery, naturally it makes you a little bit more vulnerable than a normal human being. And so, being human, there is also that fear you want to be very cautious and not overexpose yourself.
George was quite lucky when he experienced a heart attack because he was able to drive himself to the hospital, something that many patients don't get to do.
My journey has been a testimony of what God can do. In February of 2008, at the height of post-election violence, I was conducting a funeral service here at Sitam Valley Road, and after the service, I had a heart attack.
Where there is smoke, there is fire. But how did George find out it was really a heart attack?
First of all, it began with I left church, then I was driving to Chiromo campus. There is somebody who used to make very good fish and ugali, so I was going there. I was driving, but I never made it there because I started sweating profusely, yet I had the AC of the vehicle at the maximum, and I was dripping wet with sweat, and I was experiencing a pain at the top of my heart, like a straight line, like somebody using a razor blade to draw a line. Very sharp pain. After about 4 or 5 seconds, it would disappear. Another 10 seconds, it would reappear. So I pulled off the road and I called a doctor.
There are people who have never experienced a heart attack before. What are some of the symptoms one needs to look out for?
So for a heart attack, the most common symptom that we tell everyone, our patients, the members of the public, all healthcare professionals, is chest pain. When you get chest pain, you should never take it lightly. Okay, there are many causes of chest pain, including acidity and pain from muscles. But there are potentially severe causes and serious causes of chest pain, including a heart attack. And typically, a patient with a heart attack will be having chest pain that's usually behind the breastbone. Okay, it might be on the left side of the heart or the right side of the heart. That doesn't usually matter. All right. It might even be in the upper part of the abdomen, and that's why many patients confuse it for acidity. Some patients have this kind of pain going to the arm. Might go to the left arm, but it might also go to the right arm. Okay? Some people have this pain going all the way to the jaw and sometimes to the teeth. We've had patients who come in with toothaches, and at the end of the day, we actually discover they were having a heart attack. Some patients might come in with intense sweating, right? They might have a lot of sweating. Some patients might get breathless, okay? Unexplained breathlessness. Some patients might get just very nauseated, and some patients actually even vomit. Other patients, when in the setting of a heart attack, they get an electrical abnormality, they might actually faint and collapse and might get a cardiac arrest.
With the threat of COVID-19 posing a dire danger to people with chronic ailments, doctors feel the number of patients with chronic illnesses has drastically dropped here in Kenyan hospitals, especially after the announcement of the first COVID-19 case in March.
And fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
Many patients with heart conditions have failed to seek medical attention, especially in this season of COVID-19, because of the stigma that comes with coronavirus. This is because heart disease symptoms resemble those of COVID-19 in some way.
Once the whole problem of COVID started, in our hospital we started seeing a very low number of patients coming in, and we asked ourselves, what is happening to all these patients? It's not that the heart attacks have gone away, but unfortunately people are not seeking the assistance that they should have been seeking because they are afraid of coming to hospital, either because of this whole issue of social distancing, also the curfews which are ongoing prevent people from coming out at night.
Despite the uniqueness of a heart attack pain, a patient will fear to go to hospital because they'll say, I'll be screened for COVID, I'll be isolated, and I'll be stigmatized. And actually the biggest issue with COVID today is the stigma. It's not even the COVID. COVID ni homa. It's just a severe homa. It's just a severe form of it. Most of the homa, you will get, it attacks the upper respiratory airway. COVID has a tendency of going down to the lower airways. So it becomes more severe than a normal homa. But because of the deaths, the media and all that, the stigma is high. And that stigma is what will make us lose patients who we should not lose.
Frontline healthcare workers encourage people with underlying conditions to consistently seek medical attention. However, the fear of being misdiagnosed is real.
So patients who we've been following up for a long time, who are known to us, who we know them, sometimes it's enough that we talk to them on the phone and hear their voice and see how they are feeling. And based on that, we can make some judgments on whether these patients need medicines to be adjusted or whether we need to see them in person. At this point, I'd probably reach out to all the patients out there. If you do have any symptoms that suggest you might be having a condition, okay, you shouldn't be afraid to seek assistance. Always come to hospital. Of course, by all means, take the necessary steps for social distancing, but you should always come and seek assistance.
When we hear of COVID-19, we are being told that COVID-19 is really serious on such cases, and this has made most of the patients actually shy away from seeking medical attention, which actually becomes very dangerous. So my advice to them would be that they should continue with their medication, they should continue seeing their doctors because it is safer. You are at more risk in the community than you are within a hospital premise. So fearing to go to hospital and exposing yourself to the community is counter-effective.
Is fear a psychological ailment? What do psychologists think?
Mental health has always been stigmatized. People think that mental illness is when you have run mad and you need to be rushed to Madari. That is not the situation. Anxiety is a mental illness, and that is what everybody is having right now. People are anxious about what will happen with this virus. People are always sitting to watch TV, to check what the minister, the CS for health is going, the numbers that they are going to say, how many have died, how many have been quarantined, how many, that kind of thing. So everybody is actually having a mental illness right now. COVID-19 has had an impact on everybody, those who are well and those who are not well. But those that have chronic illnesses like heart problems, diabetes, dementia, cancer, active cancer, those have been most affected because they are vulnerable.
Although people with underlying conditions are more at risk in this season of COVID-19, it is not a death sentence.
And I know that most people that have chronic illness have a number of their doctor. I think the doctors, not all doctors are really doing COVID. The doctors are continuing with their work, and I think the hospitals are open. And so, go to hospital and get some support. Talk to somebody if you need to, if it is just talking to people. Talk to somebody. If you need to talk to a counselor, talk to somebody how you feel and what you are experiencing, because you know the symptoms yourself and you know what you are experiencing. And I think I would encourage them to still go and see their doctors, take the necessary precautions and go and see the doctor.
Is there hope for patients with underlying conditions during this pandemic?
Let us put our trust in God. When we put our trust in God and we have faith in God, that will help us to conquer fear. Because we are normal human beings. Our hearts are not made of stone. Our hearts are made of flesh. And therefore, the human nature is that we will fear certain situations, certain conditions. But if we put our trust in God and put our faith in God, God will give us the grace to overcome that fear aspect.
After all has been said and done, it is evident that there is hope for those people with underlying ailments and conditions. But then it is your responsibility to play your role diligently. Reporting for Hope TV Newswatch, I'm Faith Imani Mugo.